Hello, my name is Nisha Rose Davison with AgriSafe Network, and today I'm going to give a brief presentation on Stay Cool, the prevention of heat-related illness in agriculture. You might be viewing this assignment as part of a class activity, viewing it on your own, or just wanting more general knowledge about it. So we're going to take you through an approximate 30-minute presentation. We hope you enjoy it. Most of all, we hope you learn something, and most importantly, actually apply this information. So enjoy the presentation. Thanks for watching. Stay Cool, the prevention of heat-related illness in agriculture. We first want to acknowledge our funder. This program has been provided thanks to the generous support of CHS. So today I'm going to talk to you about heat-related illness. First of all, we want to start by talking about what is heat-related illness. Heat-related illness, also abbreviated as HRI, or even called hypothermia, can occur when high ambient temperature overcomes the body's ability to dissipate heat. In common terms, heat-related illness occurs when the body's temperature gets too high. Body temperature can be affected by the temperature of the air and by the level of physical activity. Our bodies create a tremendous amount of heat. Normally, it's cooled off when we sweat or by heat radiating through the skin. When it gets very hot and very high humidity, this becomes difficult, and a set of conditions known as heat-related illnesses can occur. This is a few examples of what that could be, from heat cramps, heat syncope or fainting, heat exhaustion, or heat stroke, and we'll talk about some of that in greater detail. So why is it important to know about heat illnesses? I would say the most important reason that we're discussing this is because all heat-related illnesses are preventable. Yet each year, about an average of 658 people actually die due to extreme heat. So why is heat illness important in agriculture? Well, oftentimes when you think about heat-related illness, one of the first things it'll tell you is stay indoors. Don't go outside during the prime heat times of the day. Well, when you're working in agriculture, your work is outside. So you have extensive exposure to direct sunlight. You have exposure to that high humidity. The workers span the age spectrum, and we'll talk about why that's important. And those risks encompass many different types of people, most notably children, young adults, and the elderly, especially if you have any type of medical condition. So let's just talk about a few statistics. Who is this impacting? So heat-related illnesses are preventable, as I mentioned before, yet over 600 people every year die from this. And so we don't want anyone to die from something that's preventable. During a study that was conducted by the CDC between 1999 and 2003, about 3,400 deaths resulted in the exposure to extreme or excessive heat. Just to kind of give you a little bit about age impacted, about 228 people, or 7% of that, were younger than 15 years of age. About 1,800 people, and this is a wide span of age that ranged from 15 years old to 64 years of age. In the last category, about 40% of people aged 65 and over it was about 1,300 people that actually died as a result of this exposure. So I wanted to show these numbers to show that no matter what your age, you could be at risk from this, because oftentimes we think, oh, this won't happen to us, but this affects the whole spectrum of people. And again, this could be prevented if we take the right precautions. As I mentioned about age previously, youth are extremely vulnerable to heat-related illness. This is due to a number of reasons. Infants and young children rely on others to keep them cool and hydrated when it's hot outside. So children of all ages are at risk for heat-related illness, especially heat exhaustion. In particular, infants and children under the age of 4 are at very high risk because of the nature of their body's ability to actually cool themselves off. And it's actually been scientifically proven that children sweat less and they quickly produce more heat than adults. And children also do not adjust to the environmental heat levels quickly. So for younger infants, especially those under 6 months of age, it's just important to keep them out of the sun and just avoid sun exposure, especially during those prime hours between 10 and 2 when those ultraviolet rays are most intense. And so again, we want to keep infants out of direct sunlight. Just due to the nature of their bodies, it's not recommended for those infants under 6 months of age to actually even use things like sunscreen. So we want to keep them away from that direct heat. It's very important. Younger infants do not sweat like we do. Their sweat, it actually naturally cools the rest of us down, but babies don't have that fully functioned, that function that's fully developed yet. So you don't want your baby to get overheated. And this is just a little example of a baby sitting in a cool bucket of water, and in the summertime, wouldn't we all wish that we were so lucky? So let's talk about factors associated with heat-related illness. So as mentioned before, that outdoor temperature, the length of exposure to the sun, and if you're working in the outdoors, you're usually out there for extended periods of time, especially during those intense hours between 10 a.m. and 2 p.m. Your level of hydration is important, and we'll talk about that in a moment. Your workload and the speed of your work is also going to impact how you respond to heat-related illness. Pre-existing health conditions, so if you are diabetic or have a type of heart condition, something that's messing with the way your body temperature is regulated or the way your body metabolizes things, that could affect how you're associated with heat-related illness. And then how a new person is to heat and working on the job. So acclimatization is going to be important, and I'll mention that in greater detail in a moment. And of course, age, the younger you are, the older you are, or if you have a health condition, that's going to put you at higher risk as well. So for a moment, let's talk about dehydration. Dehydration is of particular importance because if you're actually already dehydrated before you start working or an activity outside during an extremely hot and a high humid day, that's going to put you at greater risk. So dehydration, if you don't know, happens when your body doesn't have as much water as it needs. Without enough water, your body cannot function properly. You can have mild, moderate, or even severe dehydration depending on how much fluid is missing from your body. So what does that actually look like? Symptoms for mild or moderate dehydration is thirst, a dry or sticky feeling in your mouth, even your pee. If you're not peeing very much, or if your pee is dark yellow, if your skin is dry or cool, and that could even lead to headaches and muscle cramps. When we're talking about severe dehydration, you may not be peeing at all, or you'll have very dark golden almost like really almost semi-orange, if you want to say. Your skin could be very dry. You could experience dizziness, rapid heartbeat, rapid breathing, sunken eyes, sleepiness, a general lack of energy, confusion, irritability, and even fainting. So we always say that if you're thirsty, you've waited too long, so drink water frequently. Don't wait until you're thirsty or you think that you're thirsty before you're actually drinking water, and we'll talk more about that. So what is heat stress and why is it so dangerous? So heat stress refers to an umbrella term, and it describes a number of conditions or the process that can raise one's body core temperature. So we're going to talk about this spectrum of heat stress, and we're looking at the far right, and that's heat rash. So that's, even though all of these are considered very serious, Heat rash, we're going to kind of talk about that from their level of severity, where heat exhaustion and heat stroke are at the very extreme levels of our heat-related illness. And so it's important to know that any person can experience one or more of these symptoms across categories. It doesn't necessarily start and then elevate from heat rash to heat cramps to fainting to heat exhaustion to heat stroke. But we do know that you can experience any level of conditions across any stage, and they can come on all of a sudden. So you have to be mindful of that. So we're going to start with heat rash. So what's actually happening to the body when you experience heat rash? What's happening to the body is you start to notice maybe red or blotchy rash or small clusters or pimples of blisters. They may cover a large portion of the body and impede your body's ability to regulate temperature. So what are those signs? Again, you're going to see a physical red or blotchy skin, kind of maybe like a rash, that actually has extended contact with damp or tight clothing. Small pimples or blisters may actually be found in the folds of your skin or around your belt area, and these could be prickly or intensely itchy. So that's what we're talking about with heat rash. So help, what do you do when this happens? For one, you want to actually remove that constrictive clothing. So if your clothing is too tight and you're doing a number of activities and it's just kind of too tight on you, this could be causing some skin irritation. So you want to keep that area dry, possibly treat the area with corn powder or some type of calming lotion like a calamine lotion. And then you want to see your doctor if those symptoms persist more than a few days. We're going to move on now and talk about the next condition, which is known as heat cramps. So what's actually happening to the body? When you're having heat cramps, what's happening to the body is their intermittent involuntary spasms are the larger muscles that occur due to a temporary sodium or fluid imbalance while performing intense work in high heat. So your large muscle groups whatever muscle group that you're working may start experiencing spasms or even pain in those muscles, which are often found in your arms, legs, or abdomen. So what happens if you're cramping up when you're doing work? What to do? You want to stop that activity. You want to remove yourself and go rest in a cool or shaded area. You want to gently massage the area and actually drink water, clear juice, or an electrolyte containing sports drink. So you want to get yourself hydrated. And during the latter part of this presentation, we'll talk about how much water should I drink? How do I know if I'm drinking enough? So the next condition that we're going to talk about is heat syncope, known as fainting. So what's actually happening to the body during this process? So blood is pooling in the skin or the lower part of the body, causing a decreased flow of blood to the brain. When a person is standing or rises from sitting or lying position for a long period of time, the blood does not fully reach the brain at an adequate level, so that may cause fainting. So what are the signs? Dizziness, lightheaded sensation, and even fainting. And one of the most dangerous things about this condition is actually there's a lot of injury associated with fainting, falling to the ground, head injuries, and things like that. So what should you do if this happens? You want to move the person to a cool, shaded area. You want to cool their skin by applying ice packs or cool cool water to, a towel or something, and kind of putting that around their head, neck, and even possibly groin area, because this is where large amounts of blood pools, and this will help kind of cool the body down. You want to lay that person down, and of course you want them to drink water, clear juice, or an electrolyte containing sports drink. So now we're going to move on and talk about heat exhaustion. So as I mentioned, all of the heat-related illnesses are very dangerous. They're nothing to play with or make jokes of. But when we start talking about heat exhaustion and heat stroke, those are very serious on this spectrum. They're extremely dangerous. So what's happening to the body? During heat exhaustion, there's excessive loss of body salts, and the amount of water lost in sweat exceeds the water intake. So what are the signs? The skin can become pale and cool or flushed. You could have headaches, sweating, cramping, nausea or vomiting, dizziness, confusion, and even fever. So it's just a lot of things that are happening in your body. In terms of treatment, what needs to happen? Because this is, again, very severe, and oftentimes heat exhaustion and heat stroke can be mixed up, but we're just going to take you through treatment steps instead of what to do, because these steps are saying that you need to take a greater level of attention to either go to a clinic or an emergency room for medical evaluation and treatment. If medical care is not available and you're not able to get that person or yourself to a clinic or an emergency room, call 911. You want to move them to a cool and shaded area. In the meantime, you want to have that person sit or lie down with their legs elevated. You want to loosen the clothing, apply a cool compress either with ice or cool water, and move as much clothing as possible, including shoes and socks, because that will contain a lot of heat. If that person is conscious, you want them to allow them to sip water and an electrolyte beverage. And then even if this happens and you go and seek medical care, you're not to return to work that day or until approved by a medical professional, because this is a very serious condition. If you're not fully recuperated, it could be very dangerous, and the same thing, if not something worse, could happen if you return to work too soon. And it's very important that if you are the person who's seeing someone experience heat exhaustion, that when you're cooling them off and while you're waiting for medical care to arrive, do not leave that person alone. Stay with that person. Do not be left alone. So this is something I'm about to talk to about heat stroke in just a moment, but I want to talk about what some of the differences are and just kind of give you a visual here, because these two things could seem very similar. So it's important to know the difference and take action. So with heat exhaustion, you experience the faint or dizziness, excessive sweating, cool, pale, or clammy skin, even nausea and vomiting. Even if you're nauseous or feeling like you need to vomit, it's still important to take in water, to take in some electrolyte solution, because we're trying to rehydrate you. You may have a rapid yet weak pulse and experience muscle cramps. So you want to get into a cooler place, a shaded place if air conditioning isn't possible. Drink water if you're fully conscious. And then it says even take a cool shower or use a cool compress to try to cool that body down. Now we're going to talk about one of the most severe conditions of heat-related illness, and that is heat stroke. And with heat stroke, some of the symptoms just side by side are going to be possibly a throbbing headache. With heat stroke, it's no sweating happening. The body temperature is very high, above 103 degrees. You have red, hot, dry skin. Nausea and vomiting is still common. You have a rapid yet strong pulse, and you may even lose consciousness. And that's why it's important to call 911, and you have to take immediate action until that help arrives, because that's the most severe condition, and we're going to go through some of that. But I thought this was a great visual. So in the heat stroke, as mentioned in the last slide, it's life-threatening. It's a life-threatening medical emergency. There's a central nervous system failure, and your ability to sweat is lost. And that's our body's primary way of releasing heat, is through our sweat. Your body temperature may rise rapidly. So the signs are a high body temperature, a core temperature of 104 degrees Fahrenheit or higher. And that can be attained through a rectal thermometer, and that's the main sign of a heat stroke. You have an altered mental state of behavior, confusion, agitation, slurred speech, irritability, even delirium. Seizures or a coma can occur as a result of heat stroke. There's an alteration in sweating brought on by the hot weather. Your skin will feel hot and dry to the touch. However, heat stroke can be brought on by strenuous exercise. So even if you're not working, you're doing an outdoor activity, these same types of things could happen. There's nausea and vomiting involved. You may feel sick to your stomach or even vomit. Your skin may be flushed, and it may turn red as your body temperature increases. Your breathing will become rapid and even more shallow. So you may also experience a racing heart rate. Your pulse may significantly increase because the heat stress places a tremendous burden on your heart, because again, your heart is trying to pump that blood through your body to keep it cool, to cool your body off. And that's what, and you also may have a headache and your head may begin to throb. So as you can see, out of all the conditions that we talked about, the heat stroke is just could exhibit a number of really extreme signs, and that's why we're requesting that you seek medical attention immediately. So when to see a doctor if this is happening? If you experience or think that a person may be experiencing heat stroke, seek immediate medical help. Call 911 or your local emergency services number as soon as possible. Take immediate action to cool the overheated person while waiting for emergency treatment. Get the person into shade or indoors to an air-conditioned space if at all possible. Remove excess clothing, including shoes and socks. And try to cool that person by whatever means available. If it's putting them by a cool tub of water, a cool shower, spraying them with a garden hose, sponging them off with cool water, or even fanning them and misting them with cool water. You could even place ice packs or cold wet towels on the person's head, neck, armpits, or groin, because again, those are the areas where the most heat is collected, where the most blood vessels exist. And so these are all things to do while waiting for that emergency response team to actually show up. And in terms of treatment, what does that look like for heat stroke? That treatment centers around cooling your body's core temperature down to a normal temperature and to prevent or reduce damage to your brain and vital organs. So the doctor may take these steps to actually treat that person. Immerse you in cold water. A bath of cold or ice water has been proved to be the most effective way of quickly lowering your core body temperature. And the quicker you can receive cold water immersion, the less risk of death and organ damage, because again, this is a very extreme case. Use evaporation cooling techniques, or they may even pack your body with ice and cooling blankets to bring that core temperature down, and even give you medications to stop shivering, because that, if you're getting those treatments to lower your body temperature, that can make you shiver, and your doctor may give you something like a muscle relaxant to help slow that shivering down as your body temperature increases. All right, so that's why we really wanted you to pay attention to all of these heat-related illnesses and know the appropriate steps to take. This is just another visual of what those symptoms could be between heat exhaustion and heat stroke. Again, these symptoms are not exclusive to one or the other. They're just generally associated with an episode. So with heat exhaustion, we're talking about dizziness, headache, sweaty skin, a fast heartbeat, nausea or even vomiting, general weakness, and overall muscle cramps. With heat stroke, again, your body loses its actual ability to sweat. So we're talking about red, hot, or dry skin, extremely high temperature, confusion, even delirium, fainting, and convulsions. And in either of these cases, it's very important to get the person to an emergency room or medical attention as soon as possible. If you're not able to physically do that, call 911 immediately. So now that we've talked about all of the various types of heat-related illness, how do you prevent this? Because again, over 600 people die each year from heat-related illness, and this is a preventable condition. So how do you prevent this? How do you prevent this heat-related illness coming on, or even fatalities as a result of it? The number one thing you can do is drink water. Try to drink water every 15 minutes, even if you're not thirsty, if that's possible. And I know that may be difficult if you're in a work situation or even in an activity, but you have to listen to your body and you have to keep your body hydrated, even if you're not thirsty. Rest in the shade to cool down. You want to take frequent breaks at work. And I'll talk about, you have a right to request that break, even if you're in a work environment, because you have to be the number one advocate for yourself. Wear a hat and light colored clothing. Again, because of the UV rays, there are certain risks to exposure to sun. So you want to make sure that you're covering and protecting your skin, but making sure that that material is breathable to allow your body to sweat and perspire the way that it should. Keep a watchful eye over your fellow workers. It's very important to kind of operate under the buddy system again, because people are out in the extreme heat as a result of the work that they do. So you want to make sure that you're taking breaks and you're keeping an eye, kind of have a buddy system. Keep an eye on the person that you're working in concert with. Ask them, have they taken a break? Ask them, will they join you in the shade for a moment, just to make sure that you're getting enough rest, so water, and enough shade. And then if this is the first time you're working, easy does it on your first day. Your body must get used to the amount of heat that you're experiencing. So you can't go on there first day on the job, first day in extreme heat, and work the same pace that everyone else can. You're going to have to take your time to actually get used to that weather and that set of climatization that I was talking about. So again, wear appropriate clothing. Choose lightweight, light colored, and loose fitted clothing. Keep in mind that electric fans may provide comfort if you're near an electric fan, but when the temperature is in the high 90s, that will not prevent heat-related illness, because you're just kind of circulating hot air. Rest often in shady areas so that your body has a chance to recover. If there aren't trees in that landscape, that's why it's important to wear a proper, either a straw hat or a baseball hat, to keep yourself kind of covered and protect yourself from the sun rays. You have to pace yourself. If you're not accustomed to working or exercising in a hot environment, start slowly and pick up the pace gradually. If exertion in the heat makes your heart pound and leaves you gasping for breath, stop all activity. Get into a cool area or into the shade and rest, especially if you become lightheaded, confused, weak, or even faint. And then wear sunscreen. Sunburn affects your body's ability to cool itself down and can make you even dehydrated. So if you have to go outdoors, which you're working outdoors, protect yourself from the sun by wearing a wide-brimmed hat, as I mentioned earlier, sunglasses, and putting on sunscreen of at least SPF 15 or higher for 30 minutes prior to going out. So how much water should I drink? If I know I'm having an outdoor job or I'm doing an outdoor activity for a number of hours, how do I know if I'm getting enough water? So we would recommend that you try to drink up to 4 cups every hour. And I know also, there's a lot of studies out there talking about the amount of water per a person's body weight and things like that. But just as a general rule, make sure you're drinking frequently. If you're working an 8-hour shift, think about bringing or having access to 2 gallons of water for every 8 hours. So you want to make sure, if you're bringing your own water, to check to make sure you have enough water for the amount of time that you're working. At least, again, if it's 8 full hours, 2 gallons. So try to remember, just as a rule of thumb, 4 cups every 30 minutes in extreme heat. Even when you aren't thirsty, make sure that you're taking a break, drinking water at least every 30 minutes. That's a great general rule of thumb. And again, if you're feeling thirsty, you've waited too long. So you want to constantly make sure that you're drinking enough water. So just as a rule of thumb, this was a lot of information that we covered. But if you could remember water, rest, and shade, that's going to be your general rules for making sure that you protect yourself from extreme heat conditions. So you want to drink plenty of fluids. Staying hydrated will help your body sweat and maintain a normal body temperature, which is what we want. You want to take it easy during the hottest parts of the day, even if you have to work in that. If you can't avoid that strenuous activity, which most oftentimes you're not able to, you want to constantly drink fluids and rest frequently in a cool spot. And if you can, try to, schedule your physical activity or your labor for cooler parts of the day, such as the early morning or evening. Consider that if at all possible. And then, of course, you want to get acclimated. Limit the time spent working or exercising in the heat until you're conditioned to do it. If you're not used to working in hot weather, you're going to be especially susceptible to the heat-related illnesses that I mentioned previously. It could take several weeks for your body to actually adjust to that hot weather. So just know that it takes time, but during that time, there are things that you could do, like making sure you're drinking plenty of fluids, taking frequent rest breaks, and making sure you're getting shade and cool spots. And just a few things for you to know. Employers should provide, under an OSHA law, they're responsible for providing workplaces free of known safety hazards. This includes protecting workers from extreme heat. An employer with workers exposed to high temperatures should establish a complete heat illness prevention program. And so that includes the water, rest, and shade. They should be able to provide water, an adequate area to rest, and an adequate area of shade for their workers. Allow new or returning workers, if you're new to the job, to gradually increase your workloads and take more frequent breaks as they acclimatize and you build a tolerance for working in the heat. The employer should have a plan in place for emergencies and train you as a worker on what those steps are and how to prevent that, as we mentioned here in this presentation. And then they also should be able to monitor workers for signs of illness. But just know that you're a very important part of that. And remember, water, rest, and shade anytime you're working in extreme heat. Lastly, you as a worker have rights as well. You have a right to work in an area that does not pose a risk of serious harm. So you have a right to receive information on adequate water, rest, shade, and rest breaks for your work site. And there's a whole other host of information that you have access to. And OSHA can actually provide that information at OSHA.gov, and there's even a phone number, 1-800-321-6742, or 1-800-321-OSHA, where you can call and get more information. But just know that you have the right to have a safe working condition. You can request water, shade, and rest breaks on your job without any fear or threat of any type of retaliation. Just know that you have the right to be safe at any job that you perform. So we want to thank you for your time. Again, I'm Nisha Rose Davison with AgriSafe Network. This was a Stay Cool Preventing Heat-Related Illness presentation. This is a part of our Invest in Your Health program, and we hope that you stay safe and you actually apply these tips anytime you're working or doing any type of activity in extreme heat. Thanks so much and have a great day.